All right. So next on board, we're really excited to hear from Dr. Rachel Zeig-Owens for another update on a really important study that's been happening for several years on the World Trade Center. So Dr. Zeig-Owens is the Director of Epidemiology and the lead epidemiologist for the World Trade Center Health Program at the Fire Department of the City of New York. She's the principal investigator and co-investigator on multiple cooperative agreements funded by the National Institute of Occupational Safety and Health that examine cancer, respiratory disease, and mortality in the World Trade Center rescue recovery workers. She has helped to lead other research on the health effects of the World Trade Center exposure. These outcomes have included autoimmune conditions, cardiovascular disease, and hearing loss. So virtually, we welcome you. And can you hear us?
Yes, I can hear you. Can you hear me?
We can hear you. Sound great. So it's all yours.
All right, wonderful. I'm going to share my slides and get started. Thank you. Thank you, everybody, for having me today. Let me actually get it started. As you just heard, I'm Rachel Zeig-Owens. I'm the Director of Epidemiology at the World Trade Center Health Program for the Fire Department at New York City. And I have no disclosures, and just so everybody knows, there will be some photos of the World Trade Center disaster in the next slides. Because this is an international conference and many years have passed, I'm just going to review a few of the details involving the disaster, and then I'll get into our research. As many of you know, after the towers collapsed, there was a massive dust cloud with blackout conditions, and there were fires that burned through December that were created from the towers falling, and also from the diesel fuel from the jets. Over 70,000 rescue, recovery, and cleanup workers were exposed to all of these hazards, and this includes firefighters, EMS, police officers, construction workers, and many, many others. In addition, tens of thousands of area workers and residents were exposed. These exposures were not necessarily classified as well as you'd want because the air quality monitoring station that was the closest to the towers was destroyed on 9/11. So everything we know about the exposures were from samples taken near the disaster site in the days after, or from more distant air monitoring. However, if you think of an entire office building being pulverized, that's what was included in it. And I've listed some of these, but we know that some of these were known and suspected carcinogens, such as PAHs, PCBs, pesticides, dioxins. However, one thing that we know was not elevated was radiation levels. Adequate respiratory protection was not immediately available after the disaster. It was in the weeks and months following, but not right after, when the dust was the heaviest and the exposure was the greatest. Additionally, there is no measured level of individual level exposure data. So we don't know what one member versus another may have experienced and how that may differ. So all of our exposure information for every study that we have in firefighters or others is self-reported. So that's an important piece to remember. Just a little timeline of how this went down. In 2001, the CDC provided funding for medical screening of all exposed workers. Then, shortly after, the first peer-reviewed manuscripts were published showing that World Trade Center exposure was associated with respiratory symptoms and conditions, as well as mental health conditions. To date, over 800 manuscripts have been published on these health effects of those who are exposed. In 2004, a federal grant allowed for more medical monitoring. And then in 2011, the James Zadroga 9/11 Healthcare and Compensation Act was enacted. As part of this, the World Trade Center Health Program provides medical care for World Trade Center related conditions. At the time, that was limited to respiratory and mental health. And then in 2012, thanks to our research and others, cancer was included as a World Trade Center condition. This means that cancer screening, diagnostic evaluations, treatment, and case management of cancer care are all included at no cost to the patient. And then in 2015, the Zadroga Act was reauthorized for another 75 years. So I have lifetime employment. I'm going to give you a little bit of a background on the FDNY cohort so that you know what I'm going to be talking about in more depth as well. Our cohort is a roster-based cohort. That means we include all firefighters and EMS who have been employed by the fire department. And this includes over 15,000 FDNY exposed firefighters and EMS. Our data includes full name, date of birth, and full social. Dating back to prior to 9/11, all active firefighters and EMS received their medical monitoring and treatment through FDNY's Bureau of Health Services. And we capture these data electronically. This is dating back to prior to 9/11 as well, as early as 1990s. Beginning on 9/11, treatment for the World Trade Center related injuries began, and that's because we already had that infrastructure in place. And very shortly after, just on October 2nd, medical monitoring began, and that included an electronic self-administered questionnaire where we were able to capture World Trade Center exposures and members' current symptoms. And these efforts were really led by Doctors Carrie Kelly and Dr. David Prezant. Dr. Prezant is now the Chief Medical Officer and has been for many years now. This is a snapshot of our cohort. You'll see that our members are predominantly male and predominantly white. You'll also see that on 9/11, the average age was around 40, and now our members are in their early 60s on average. You'll also notice at the very bottom that the current status is that only about 18% of our population are active. And you'll also see that 5% have died. To date, 343 members have died due to World Trade Center related illnesses. More have died due to other causes as well, but this is a key distinction. And this is the same number of members who died on 9/11. Nearly all of our members arrived in the first 48 hours of after the attacks. You'll see the red bar is the morning of 9/11, with 14%-ish of our population arriving then, and then a vast majority arriving in the afternoon, and then the following day, the yellow bar. Also, the majority of our cohort are never smokers, and a lot are also former smokers. We have very few current smokers in our population. So World Trade Center and cancer studies have included two main World Trade Center exposed populations. The rescue recovery workers, which includes firefighters and EMS that I will speak about as well, and also non-rescue recovery workers who were the local residents and workers. Most of the studies to date have included the rescue recovery workers. Many of our studies rely on cancer linkages. These are the same cancer linkages that Dr. Fent just talked about a few minutes ago. We link our whole roster to the state cancer registries. And if you recall, for FDNY, that includes their full Social Security number, their first and last name, sometimes even their middle name or their maiden name, depending on if that's applicable. We also have their date of birth, address, and other identifying factors. And this greatly improves the accuracy, especially when members have very similar names and potentially same birth dates as others. These linkages are important as they don't require a firefighter to tell us about their cancer. And that means that we have complete case ascertainment. So if a member were to get cancer and die very soon after because it was a very aggressive cancer, we will still know about it because the state cancer registry will have that information. It doesn't mean that the member has to tell us about it or that the member's family has to tell us about it. The one drawback is that this process can take months to years to complete, and it can be a lot of administrative work. So in 2011, FDNY published the first World Trade Center and cancer study. And I'm going to go very quickly through these early studies, and then I'll go into the survival as well. What we found in this first study was the risk of all cancers among World Trade Center exposed male firefighters was slightly higher than the US male population, but it was not different on a statistically significant level. However, thyroid cancer, prostate cancer, non-Hodgkin's lymphoma, and melanoma were all significantly higher than the US population. One to point out, though, is the risk of lung cancer was significantly lower than the US male population. And this is likely due to the lower smoking rates that we have in our population, if you remember from some of my earlier slides. Our findings were then replicated in 2 other cohorts of rescue recovery workers, the World Trade Center Health Registry and the general responders. These do have some firefighters in them, but most of them are other types of rescue recovery workers. Most recently, we then also combined all of our cohorts together and took out duplicate individuals so that we had a complete cohort of over 69,000 World Trade Center exposed rescue recovery workers. What we found was that the cancer rate for our members compared with the general population was no different. It might even be slightly lower. If it was a 1, then it's exactly the same as what you would expect based off of the general population. The rates for thyroid cancer and prostate cancer were higher for all studies compared with the general population. In some cases, it was 2 to 3 times greater than what you would expect for the general population, especially for thyroid cancer. Skin melanoma was also elevated compared with the general population in some of these studies. However, many found that lung cancer rates were significantly reduced compared with the general population. So the question really comes down to, is the general population a good comparison group for us? Firefighters and other rescue recovery workers in general may have increased risk of cancer due to work-related exposures, as you've been hearing about throughout the past couple of presentations. Alternatively, their risk may be lower due to healthy worker effects and lower smoking rates, as I mentioned, thereby possibly masking a World Trade Center exposure effect. So I actually just heard somebody in the audience ask about the Daniels cohort. And this cohort was, I'll give a little bit of a background and then go into how it impacts us. In 2009, CDC and NIOSH assembled a cohort of 29,992 professional firefighters who were employed at any time between 1950 and 2009. These were firefighters from San Francisco, Chicago, and Philadelphia. And this is also a roster-based cohort. So everybody was included, regardless of if they were alive or not at the time of 2009 when the cohort was assembled. We obtained funding in a grant form and then now in additional funding to add FDNY firefighters, both exposed and non-exposed, to this original population. And we've renamed this population, with the blessing of NIOSH, to be called the Career Firefighter Health Study. It now totals over 60,000 firefighters, and we're in active talks with additional fire departments to add more members to this roster-based cohort. What we have done was we have conducted state cancer registry linkages, and we've also linked with the National Death Index Registry. We, for a subset, have conducted a web-based survey for health characteristics and reported and self-reported diseases. By collecting the behavioral data, such as smoking, and also the physical and mental health symptoms and diagnoses that aren't obtained through cancer and registries and National Death Index registries, we're able to have a wider breadth of information on the members. The FDNY firefighters have annual monitoring questionnaires that are very similar to the ones that we include in this questionnaire. So what we have found is when we compared cancer incidence rates of FDNY firefighters, World Trade Center exposed firefighters, to the non-World Trade Center exposed firefighters, we found that all cancers were significantly increased in FDNY World Trade Center exposed, as well as thyroid cancer and prostate cancer were also increased. There was no difference in the rate of lung cancer or skin melanoma. What we also found, we compared the non-World Trade Center exposed firefighters to the US population and found that the non-World Trade Center exposed firefighters had significantly higher rates of prostate and skin melanoma and lower rates of lung cancer. I am going to make one comparison with the Daniels study, is that for our studies, we looked at firefighters who were actively employed on 9/11, thereby looking at a younger cohort and potentially a cohort that had different types of exposures and a lower smoking rate than the Daniels study in entirety. We also looked at their mortality rates, and we found that firefighters have a lower mortality than the general population, both World Trade Center exposed and non-World Trade Center exposed. You'll see here with the arrow that both have a standardized mortality ratio, which means that we're comparing the mortality rate of the firefighters to the US population and looking to see what is expected. If it's below 1, you see that it is less than expected. So we are seeing that the rate of all cancer mortality is lower for both World Trade Center and non-World Trade Center exposed firefighters. The one that is elevated, which makes sense, is the second row from the bottom, and that's fire in buildings. Unfortunately, that is what you would expect for this population, but it also shows that the data we are capturing is a valid capture. So I'm going to go into some World Trade Center and cancer precursor data that we are looking at. About a decade ago, we collected blood samples from nearly 3,000 World Trade Center exposed FDNY firefighters and EMS to create an FDNY biobank. One of the first studies we did was we screened for a precursor to multiple myeloma, which is called MGUS. And we collaborated with Dr. Ola Landgren from the University of Miami. We compared the prevalence of MGUS in the World Trade Center exposed firefighters with the general population. And we found that the risk of this precursor for multiple myeloma was 1.8 times greater in our FDNY World Trade Center exposed firefighters compared with the general population. And this was mostly driven by a subtype called light chain MGUS, where it was 3 times greater than the general population. More recently, and this study was actually discussed very quickly yesterday, we looked at the precursor to multiple myeloma, which is called clonohematopoiesis. And this is a genetic mutation which is associated with an increased risk of hematologic malignancies, as well as inflammatory disorders such as cardiovascular disease. And this is one that you are not born, this is a genetic mutation you're not born with, but it develops over your lifetime or may develop over your lifetime. We found that the overall prevalence of clonal hematopoiesis in the World Trade Center exposed cohort was 10%. And this was a higher odds of, we found that the World Trade Center exposed firefighters had a higher odds of the mutation compared with non-FDNY, non-World Trade Center exposed firefighters, about 3 times greater. What was also interesting was we found that mice who were treated with World Trade Center dust that was collected and stored also developed the similar mutations. So there is both the human analysis that we did, but then also the mouse models that were confirming our findings. So we're seeing that that there are places where people are getting more cancers, but we wanted to understand the survival. And we found that though post World Trade Center post cancer diagnosis, the World Trade Center exposed rescue recovery workers were actually more likely to survive than the general population. They had a lower risk of death than cancer patients in the US, in the New York State population. We did not find the same for workers who were not enrolled in the World Trade Center health program. And we, in fact, found that they had a similar risk of death. So I'm going to say this again because this is important, that the workers who get the health care from the World Trade Center health program, and if you remember, that includes free screening, free treatment, and case management of your treatment. That those people who are in that health program had a lower risk of death. So could this benefit in survival be due to the health care the responders are receiving as part of the program? Or could this benefit be due to the fact that firefighters were healthier before their cancer diagnosis, and therefore meaning that their bodies were more able to withstand the cancer treatment and to fight the cancer? We have a newly funded grant that will investigate these reasons for the survival benefit. And to do this, what we are going to do is looking at World Trade Center exposed firefighters and comparing them with the non-World Trade Center exposed firefighters from the career firefighter health study that I mentioned a few slides ago. So in summary, the World Trade Center exposed individuals have elevated rates of some cancers and cancer precursors. However, with cancer screening and increased care after diagnosis, survival may be improved. And this is not just a World Trade Center finding or findings that are only isolated to those who are World Trade Center exposed. If better healthcare improves cancer survival, these findings may be applicable to all populations, not just World Trade Center exposed. So for the firefighters who have been on the job for 15, 20 years already and have had what feels like a lifetime of exposure, there's still information that we can gain from these studies to help them in 10 years if they do develop cancer, so that it's not a lethal diagnosis, that they can still have life after that cancer. So I want to end on that positive, that we can take the World Trade Center exposure information and how there may be elevated cancer rates, but that not everybody is dying from this. And that is where I want to try to make sure that we're all on the same positive upbeat for that. So I want to end with a thank you to my whole team, because this is a team effort, and to our collaborators from the World Trade Center Health Program and the San Francisco Fire Department, Chicago Fire Department, and the Philadelphia Fire Department. Thank you.
Okay, we're happy to entertain a couple of questions to Dr. Zeig-Owens about the World Trade Center program. If you would not mind just coming up to the microphone so she can hear you since she's joining us virtually. Dr. Stapleton.
Okay. Yeah, hi, Heather Stapleton, researcher at Duke University. Rachel, thank you for that talk. I was really intrigued by your higher rates of thyroid cancer in a couple of those studies. My understanding is thyroid cancer is much more common in women than men, like 5 times higher in women versus men, and I just wanted to know if you had looked at that. In the firefighters, was it equally elevated in both males and females? And then secondly, there are several subtypes of thyroid cancer, like papillary, which seems to have a stronger link with environmental, versus medullary, which I understand has more of a genetic component. Did you look at the subtypes of thyroid cancer and specifically papillary thyroid cancer?
Yes. So in fact, this was what my dissertation was on about 10 years ago. So what we found was that the vast majority were actually detected incidentally. Majority of our population is male, so the vast majority of cancer tumors were also among males. What really it is found is that they are screened for lung cancer. They're screened for head and neck, like sinus CT scans, and these nodules were being picked up via these incidental screenings. So they were not symptomatic, and that's where that was a lot of those are coming from. They are, I think all except for one were papillary. At the time, I haven't looked in the past about 5 years, but that's still probably the case. Thyroid cancer has been increasing in general in the US with the more sensitive equipment to screen for other things. So there has been some more incidental detection. Whether this is World Trade Center related or being picked up by the screening that our members get in general is a little bit hard to tease out. And that's, one of those things that once you start screening for cancer, you're going to pick up more cancers that may not have been detected originally.
Awesome, thank you very much. Take one from over here.
For interested departments, is it a open recruitment or invite only for the study?
For the other,
Because you're adding.
I'm sorry, I missed the first part of the thing. Open recruitment or what?
Yeah, so for interested departments, is it open recruitment? Interested departments can contact, or is it invite only to enter into the study?
Oh, my email address was on that last slide, but you are more than welcome to reach out to me about this. We have funding right now to be able to link a number of additional participants or rosters, really, because this is not something that needs active recruitment from members.
And
So yes, the short answer is you can reach out to me and I'm happy to continue conversations.
one more question. The state cancer registries, are you accessing all of them, or is it selected right now?
So right now we're accessing 18 because of the states or the cities that we are we have in our cohort. They are the ones where everybody is mostly residing in. However, we're also part of the virtual pooled registry, which is, I believe, Kenny Fent talked about briefly at the last talk, which allows us to understand if we are going to be picking up others from additional states. What that also means is that as we add more fire departments, we're going to be adding more registries. For example, we don't match with Massachusetts right now, but if Boston were to be included in our study, we would then link with Massachusetts and Rhode Island, Maine, New Hampshire, et cetera.
Okay, we're just out of time, so I'm going to cut off our questions. But Dr. Zeig-Owens' email is available. Please do engage her and Dr. Prezant on any questions regarding the New York Fire Department cohort, and any departments that are interested. Please do reach out to her. Rachel, thank you again so much. We really appreciate the update on the World Trade Center and the cohort. Thank you.
Thank you.